Hello and welcome to Module 3. This particular module focuses once again on professional behavior and respecting yourself and others. I hope you were able to successfully complete the last two module quizzes and that you felt like you learned from them. There'll be some more learning here in terms of this is going to go more in depth on professional behavior in nursing, focusing on respecting yourself and respecting others. Once again, there will be a quiz related to the content at the end of the module. Like the other quizzes, you can look at the content. We're not trying to trick you. There's no negative consequences on your course by not doing well, but I hope that you will be able to do well on all of these and look back on the information and make sure you get 100% before you move on, as you will be expected to follow this information throughout the nursing program and your career too. We hope the quiz will reinforce your learning and your understanding of the concepts. You can take the quiz more than once. Until you pass, you do need to get 100%, and at the very end you will sign a piece of paper saying that you understood the content, willing to follow it, and that you did this on your own. So in terms of respecting yourself, it involves mainly dressing and behavior in a professional manner. Respecting others mainly focuses on treating each person with dignity and courtesy, whether they are your clinical instructor, whether a patient in the hospital, whether a nurse on the floor, could be anything. People make judgments about others and about their appearance, so perception is very important. It might not quite everything, but close. And decisions on what you wear can influence people's feelings about you and about your character. And first impressions certainly do make a difference. In terms of professional attire, the clinical setting, students are required to dress, quote, professionally, but what that means is up for interpretation. However, if you look for student nurse in our student nurse handbook under policy S3300, you can find some more details about what that might mean. And I highly recommend you go and you look at that. Clinical sites have set up policies for attire, and so even though we have some general guidelines on what the student should wear in terms of what your uniform should look like, there may be other changes depending on what facility you go to and what they consider in terms of nursing care and safety. And that's the main reason we look at professional attire as personal care and safety and patient care. We are guests in facilities, so we have to abide by their policies whether we agree with them or not. Some research findings by Thompson et al., which means there's a variety of people after that, studied the influence of nurses' appearance on patients. And they found, and this is a quote, all subjects rated the nurse with the most body art. They showed them a variety of different pictures, and this included piercing invisible tattoos, the least caring, skilled, and knowledgeable. Basically, they put some pictures in front of people, said, who do you think would do the best in terms of taking care? And people that they saw with piercings and visual tattoos, they felt overall, even though they may not have even acknowledged that that was occurring, that the caring skill and knowledge was lowest on those people. Many of the policies help improve safety, such as restricting acrylic nails and long earrings and require hair to be pulled back, because acrylic nails have been found in some research to increase infectious rates. Long earrings can be pulled out and actually really damage ears, and some ugly injuries about that. And long hair hanging over can drop into sterile areas and cause infection. So more about professional attire. The School of Nurses policy regarding it in terms of institution. Dress code policy that abides by the rules of various institutions has been created. Although I must admit sometimes there might be some variations in the rules. Students' dress is dictated not only by the facility's policy, but what the students are doing at the clinical site. For example, if you might be doing a leadership clinical, you probably wouldn't be wearing your scrubs to the clinical site if you're working with a nurse manager. So appropriate dress for clinical days when direct patient care is not provided in the hospital may vary. Your clinical instructor will let you know if your clinical site has different rules that must be followed. When not caring directly for patients, students must wear specific things to the clinical site: a lab coat with a School of Nursing patch, a name tag, closed-toe shoes, so no sandals are allowed, and long pants or longer skirts. Socks and pantyhose are required. Students cannot When not caring directly for patients, students must not wear piercing on the face, shorts or short skirts, blue jeans, tank tops or t-shirts, or clothes that show the stomach or chest area. One thing I also mention is I have students at schools, at a couple public schools, and when we go to those public school sites, we need to follow the rules that the students have, so we're not dressed differently than the students in terms of the rules, which that last slide pretty much follows what the school needs to do. When not caring directly for patients, students must not wear caps or hats, other attire that may be deemed sloppy or inappropriate for business-like settings. When not caring directly for patients, students can wear their uniform when they go to get information about their patients or meet with people. And for example, we did, for my clinical group, we did a health fair, and the 2 days in which we were doing the health fair, the students chose to wear their uniforms. They just thought it looked professional, and everyone knew who we were and what we were doing, and that worked out really well. When caring directly for patients, students must wear blue scrubs unless specified by the instructor. In addition, the student may not wear any of the items that are listed in the not caring for patients section. So no blue jeans, no open-toed shoes, no hats, things like that. Getting accustomed to wearing professional attire may not be easy at first. I know I've had a lot of students who are like, I don't have anything but blue jeans. What I recommend is go to Idaho Youth Ranch or Savers or something like that and get a pair of khaki pants. That'll save you. You just need one pair, and then when you're going out and about, you can look professional. You don't have to worry about, oh my goodness, what am I going to wear? I think most people feel a little bit more comfortable when they're dressing professionally, when they're around other people who are dressing professionally. And this can help build self-esteem and self-confidence within you and other people's perception of you as a confident person. Now I'm going to move on to respecting for others. An overview. Everyone wants to feel respected. Respect is a reciprocal feeling. You will not be respected by others unless you show respect to them. Respecting others includes showing consideration for the self-worth of others. Respect is a basic right that we all possess, or at least want to possess, and as nurses we must respect all people, whether they are premature babies, child abusers, or sex offenders. It's not our job to judge other people. Our job is to provide the basic care for everyone. Respecting others also means working in a team and teamwork. Nurses can't provide care alone. We must work effectively as a team. And team members must show respect for each other as a team member and for the team to be effective. At school and in clinical settings, students need to respect the instructors, patients, family, staff, and others. And through respect and teamwork, excellent patient care can be provided. At BSU, when you're on campus, ways to show respect include arriving to class on time. People who come in late and disrupt class are not being respectful. Being prepared to learn and work. Not doing the reading, not having done the assignments beforehand, when particularly you know there's going to be group discussions you're going to be asked to be involved in, isn't showing respect for others. Turning off the sound of cell phones and other disruptions during class is also very important. And it's also important to pay attention to what others say. When other people are talking in class, whether it be the faculty member or the student, working on the computer, sending text messages, things like that are not respectful. So by respecting others, you're not going to be interrupting others when they talk. You're going to be completing assignments on time and being prepared. You're going to be polite, patient, and courteous in terms of in person, in emails, and on social networks. And that includes, once again, with your classmates and with faculty members. Respect also means working cooperatively, asking thoughtful questions during class, encouraging others to be open with their emotions. I also encourage students in terms of asking thoughtful questions, not to take over the class and be the one who always asks questions, but see, how are you in terms of asking questions compared to other people? If you find you're asking 3 questions, everyone else is 1 question, maybe you should write those questions down and ask it after class, because your classmates may sometimes feel that you might be asking too many questions and disruptive. So think about how others might perceive you. To respect others, realize that everyone has bad days, and be tolerant of the differences of opinion. Being open to new ideas. Not everyone thinks alike, and that's a really good thing. And know that we can learn something from everyone, even if they don't agree with us and they don't have our opinions. Respecting them, listening to them, is a way to open up new thoughts and ideas. By respecting others, we're going to work to find similarities between us rather than differences, whether that's be with faculty, with students, with patients, with staff members in the hospital. Looking for the good in people and not the bad is very helpful. Being flexible and considering alternative solutions to problems. How can we work together? How can we get this done? How can we be a team member? Asking yourself, how can we do this better? Really important. Also need to think about respect outside the classroom. The internet and social media are places where students must show respect for classmates, staff, instructors. I would ask that at this point, or right after you finish this video, that you look at the National Board of State Nurses website. Actually it's the YouTube that they've developed. I think they have it on their website too, but YouTube's easy to get to. And when you're there, you can see about their ideas about social network and the importance of being respectful. I think I mentioned in one of the other videos that people have lost their nursing license, they've lost positions in nursing programs because they have posted inappropriate information about patients and others on the web, and so it's really important to be aware of that. Following principles, we call it Netiquette. You'll see this in probably every syllabus that we expect you to follow Netiquette, and there's a website here about what that might be and what that looks like, how to show respect on the web. Now, sometimes it's easy to just pop something up, particularly if you're angry. I always ask students, and I ask myself too, would I want to see this on the front page of the newspaper or the headline first story on the evening news? Because it's possible it might be. It's a small town, things get around. So unless you want everyone to know what you're writing and thinking, I would not put it up there. So it's very important that you realize as a nursing student, your communication needs to be supportive of others online and also offline. Don't put online what you wouldn't want to see, like I said, in the front newspaper or on the daily news. So be respectful of yourself too. We want to all have high respect for you, and if you respect yourself, you're more likely to have others respect you too. So you'll develop a high respect for yourself and ability to work more effectively as you build self-esteem and character. As with cheating, it's your responsibility to make sure that other students, faculty, and staff treat each other with respect. If you see disrespect happen, it is your responsibility to acknowledge disrespect. And if you are unsure what to do, speak with your instructor or advisor. You will shortly in your 4th semester have a person named Dr. Cindy Clark come and talk about civility and what it means to be civil in nursing program and in nursing, and she will talk about many of these themes, so you'll hear that from her too, and she's an excellent person to ask questions to. So respect for others is an expectation of our nursing students. It is students' responsibility to show respect for themselves and others, and one way to do this is to act and dress in a professional way. There are many resources available in terms of respect, teamwork, and professional attire. Here's a couple that I find helpful. The ethics.org, and then Nursing World has some ethical information. So you're about ready to, I think, take the quiz. I would stop if I was you, go through these slides, check it again. You might want to re-listen to this and then take that quiz. Once again, Like with the last quiz, you need to get 100%. You need to work on your own. You can look at your notes, but you are not allowed to look at notes from other people or work with other people. Once again, here's a bibliography of some information related to the topic. And thank you very much for your time and attention. I hope you found this worthwhile and do very well on the quiz. Thank you. Bye.